Good morning, good evening, good afternoon, good day. Yes, to begin with, I'd just like to say thank you so much to Agnes and the Australian Sickle Cell community. In this conference, we're just inviting options for children in Zambia to share about our organization. We are so thrilled to be part of this and just sharing what our organization does and the impacts that we hope to achieve, that we're doing right now, and also hope to achieve for the future. My name is Tamara Sakala, and I am with Options for Children in Zambia. And I'm just going to present a little bit about our model as Options for Children in Zambia, which uses the dental magnet strategy to help start screening for sickle cell disease. Yes. Um, just a little bit background about Options for Children. So Options is a nonprofit, which is a 501c3 nonprofit, and we got our status in 2016. But before that, we've been going to Zambia annually or by annual trips to Zambia since 2004. With Options started off just going to Kasisi Children's Home, which is an orphanage right out of a little bit out of Osaka. It's near the airport, and that's where I grew up. Kasisi Children's Home has been my home since I was 4 years old, and that's how I met this organization from there. And I'm so happy to have joined them as I got older and finished my education. And I'm happy to be part of this very big cause and this big impact. So Options has been working, started off at Kasisi Children's Home and also at Buchila Village, which is a village that a lot of people don't know about, even if you have grown up in Zambia. Speaking about Zambians, sometimes there are some areas that people don't even go there, and we forget that there are actual people that live there and that need this healthcare, you know, uh, services that sometimes we might take advantage of just having and not realizing that other people don't have access to this. So Options has decided to go into these rural areas that sometimes, you know, not a lot of healthcare people might go into. So yeah, that's a little bit about our background. So Options has the capacity building model, which is divided into three, and I'll go more into it in a few slides. But basically, we bring oral health prevention into rural communities. And then we also work with supporting local resources that provide, rural, oral health prevention and treatments. And then from that, we'll hope to piggyback other healthcare services to go into further out in the villages or just, places that don't have these healthcare benefits. Um, yeah, so speaking of, bringing oral health prevention as the number one building block, so we usually, attract a large number of people that come for dental services. As you can see, there's like a lot of people in that photo that came, that when the dental team comes from here going to Zambia and go to these villages, and then the news goes that the dental team is here. So a lot of people come to these to receive dental health, such as toothbrushes, toothpaste, fluoride vanisher treatments, and just also just screening and cleaning people's teeth. And from there, as you already have all these people gathered in one place, as that's also a challenge to have, a lot of people come to receive any healthcare treatments, but having people already come with this, in mind of having their teeth looked at, their teeth checked, that, get toothbrushes, get toothpaste. And our hope is like then these people can, receive other healthcare prevention, such as malaria preventions, HIV screening and counseling and other treatments, and also vaccines. But our focus has been, on screening for sickle cell disease, which is also, sickle cell as we all know it. I won't go into explaining much about what sickle cell is, as this is a sickle cell conference, and I believe that we all know how, this disease is, even if it's, it's very neglected disease. So I would say it's neglected disease, even if it's a very, it's one of the most common genetic diseases, but it doesn't get that much attention. And so you'll find, malaria prevention or HIV screenings, counseling, people get those services, which is great. But then sickle cell screening, people don't get screened much for sickle cell, and they might not know that they have sickle cell. They might be in pain, but not knowing what's causing that pain, because sometimes even the symptoms for sickle cell tend to overlap with that of malaria and other diseases. So yeah, we decided to screen for sickle cell disease to bring that service to the people who have already gathered in this place. So, and then the third building block is also to support our local resources. And so with that, we teamed up with, Zambia has a good dental school. And so bringing the dental team from here, from the United States, and just working together with the dental school there in Zambia, I believe, participatory development is the best way to go. So instead of just, people coming from different places and coming to do this development projects or having to do these services in a country, but to involve and to include the locals, to include the people of the country, to include the people in the community. So it's like we make this development our own. We have to participate in this. And so the dental team in Zambia has done a very good job, in just working with the other, dental healthcare workers from the United States. And so the first time, that the dental school came, and we went to Muchila, which is a village out also in Zambia. And because of that, because of the dental team themselves, we got a lot of people come and gathered, more than the previous years that we've done this. More than 1,000 people attended the, the services or the call. They heard that the dentists were here in this village, so a lot of people came for these services. And as you can see from this, from this chart here, just a little bit of numbers just to show the difference that makes when, the local team comes in and helps I wouldn't say the outsiders, but then people that are coming in from other countries to, to try and bring this healthcare development to a country. But in 2012, when the dental team joined and started, coming to these villages with doing the outreach work with the Options for Children in Zambia team, you can see the numbers going up from, the total screening. We're talking about teeth screening here. I'll go into the sickle cell screening in just a little bit. Just wanted to show you where I'm coming from. So yeah, so you can see the numbers go up from 2008, but 2013, you see how the numbers go to, into thousands then, and then, people that are then, giving those surgeries. But without having the Zambian dental team there, it would be impossible for us to do it, for these surgeries to be done, because you also need the team, you need the hospitals to send people with, professionals, dentists themselves. And so it's very critical to have the dental school join this project as well. And so anyway, so putting the dental project on the side, so our goal has to use the magnetic effect of the dental services to piggyback other healthcare programs, as I mentioned before, but our biggest focus is on sickle cell. And why do we say, to piggyback other healthcare services? So this magnetic effect of dental services, everybody came. As I mentioned, thousands of people came to just get their teeth looked at, to get toothbrushes, to get toothpaste, to get fluoride vanishes. But then it's like, yes, we have all these people here. What more can we do with this? People are already out here. So why not screen them for sickle cell? Why not educate them about sickle cell? Why not, do more about about this? So this is what our goal was, and it's what our passion was, to do more with this sickle cell disease. And so, yeah, somebody might ask, like, why sickle cell? Why not other diseases? Yes, there are a lot of other diseases. But as I mentioned, sickle cell is pretty much very neglected. It's a painful disease. It's yeah, and just knowing that, having that knowledge that when people are screened, early diagnostic for sickle cell disease, we prevent thousands of sickle cell child deaths each year. And that's why sickle cell is very important for me and for the organization, for the nonprofit, and for everyone here. I believe that we have more advocates, we have more people speaking about this, we have more information out there. And then other reasons of why sickle cell, it's in developing nations, but speaking for Zambia, that's where I'm from and that's what I'm familiar with. And just seeing, the work around sickle cell and just patients and just people who've had sickle cell, people who've suffered through sickle cell, and growing up at the orphanage, as I mentioned, you could also see that. But then as we go out into the bigger populations, you can see that the awareness anyway for sickle cell is very poor. Then patients also dispersed in vast rural areas. In most of these areas, people have to travel miles and miles to get to the hospital. And even if they get to a clinic that may be closest to them, that clinic might not be able to actually screen them for sickle cell. Maybe they might be able to screen them, but then to just validate that, or to just diagnose, to make a diagnosis that somebody has sickle cell, it will take even days, weeks or months. So we know that sickle cell needs a point of care, testing. And as I mentioned, in some of these areas, there's no electricity, there's no water, there's no all these things, and it makes it harder for you to do like a sickle cell point of care diagnosis with no resources. But even if those things are happening with options, we decided to, what can we do? How can we bring, this sickle cell screening out to the people? Yes, there's this need, but what can we do about it? So in 2017, combining dental work and the sickle cell screening project, that was like our first kind of like a pilot program to test how this could work out, how we can use dental and sickle cell and bring them together, and to make this work. So we started off in Serenge. That's where the testing happened. So in 2007, again using the rural health center, they're again using the local resources. They are using the local people. They publicize that the dental team is coming, and so a lot of people came. In this case, in Serenge only, it was like 600 people, a little bit over 600 that received. They received oral health instructions. They received the fluoride vanishes, toothbrushes, and toothpaste. And then with that, 500 people got screened for sickle cell. And these were people that were under 20 years old. And in this time, 2017, we used what we called the PANA testing device, which was a device that Options started working on developing, and that it uses like a very low battery energy. So it can be taken out in places that do not have electricity to test for the sickle cell. But then with that, that was just like our very, it's like introducing this screening into this place. So what we had to do now, after people have come and they got tested, they've gotten screened. So we had to bring the dried sample of the blood to the US so it can be validated. Again, if, just to, on that point of validating the sickle cell in Zambia, I mean, private hospitals might have the tools to validate for sickle cell, but not so much in the government hospitals. And sometimes people have to pay lots of money. I mean, lots of money, yes, in the Zambian kwacha for them to just get that test validated. And by the time that test gets validated, it takes a longer period of time. And then so we brought the results to the United States in the labs, be tested and validated. And from the 500 people that were tested, that were screened for sickle cell, 78 of them had the trait and 17 people had sickle cell disease. I mean, this just shows the importance how of just screening, people might have not known that somebody had sickle cell, somebody had the traits. But yeah, as I mentioned, having the team, this is like a very good team of people from different areas of the healthcare places that came to join together and to make this project come to life. And it's very huge. I emphasize to have everyone involved, local people, people from all over the place, from different industries or different healthcare places to come together and make something work. But yeah, fast forward in 2022, sorry. Yeah, 2022, time has gone by since COVID started. But then 2022, this year, we, just having conversations with the sickle cell communities, with Sanseva and, with Agnes, we got connected to a Hemex Health, that they have this very, point of care testing of sickle cell screening device that they have, which is very easy to use. They call it the Gazelle. And so instead of us using that panel test that we started off with, and then we had having to bring the results, the dried samples of the blood to be tested in the US, this makes it all much easier. Somebody can be screened there and then and get their results in 8 minutes. And these results can be transmitted and be stored on the clouds, for patients, for tracking the diseases and all that. But it was so nice and so good to be, to know that there are manufacturers that have already manufactured this this device. So instead of options going ahead and trying to find funds or to manufacture our own testing device, like, okay, we're gonna go and and buy some of these machines, because my understanding, or our understanding, is like Zambia only had like one for the public hospitals, one machine that would validate sickle cell. So we managed to get 5 more of these machines to be placed in 5 government hospitals, which I'm very excited about. Options is very excited to have these machines. People can pay less than what they would normally to come and get tested. And the results will be given in 8 minutes. So I'm very excited to see this go, and just how easy it will be for somebody to get screened for sickle cell. I wouldn't even just mention the importance of being screened for sickle cell, the importance of knowing, the sickle cell status, and the change that could bring into people's lives. And so, yeah, our ambitions option is to combine the strategy of healthcare prevention and sickle cell diagnostic screening into rural areas, into the entire country of Zambia. So going off from the syringe testing that we did, and then, doing this on a larger scale in the whole country. I know there are also other organizations that are working with screening for this, for sickle cell, and working in the same field. And we just hope that we can all work together and partner together to do this. I know we can do it together. Yeah, but for us to do all this, and for us to go move forward and keep making this biggest impact in the community, or just in the country, and just all over Africa eventually, and to other parts of the world. Yeah, big dreams. But I would say, the project would require the sickle cell device, the people that make the sickle cell device screening, the devices, we need those people. We need the dental training school. We need the University of Teaching Hospital of Zambia, UTH. We need the Ministry of Health. We need Sanseva. We need everyone, each and every one of you is needed. Each and every one of you can make a difference. Each and every one of you, I believe we all have ideas, and we all can make a difference in people's lives if we just come together and work together for this common good. That is my presentation. That is on options. Thank you all for your attention. Thank you all for listening to me. Yes, thank you so much. My name is Tamara, again, with Options for Children in Zambia. I look forward to working with each and every one of you, and I look forward to connecting. Thank you so much.